Hey, folks, welcome to another edition of Broken Brains with Bruce Parkman, sponsored by the Mac Parkman Foundation, where we look at the issue of repetitive brain trauma, from repetitive impacts from contact sports and repetitive blast exposure in our veteran population, and what these issues are doing to the brains and mental health of our children, veterans, and athletes. Why is this so important? Because this is not trained. It's not trained to our nursing, medical, psychological, suicidal prevention communities. And so you have to be informed. And on this show, we reach out to researchers and doctors and scientists and patients and players to bring you that 360-degree view of this, because this affects millions and millions of Americans across this country every day. So here on our guest today, another awesome guest for us right here is Dr. Drew Thodeson, a pediatric neurologist, I'm going to skip on that one, and neuroscientist. And I'm going to go back that one because I never miss words. But Dr. Drew Thodeson is a pediatric neurologist, epileptologist, and
epileptologist.
What's
You're
that?
doing great. Epileptologist.
Right. Epileptologist.
I should have wrote epilepsy doc. I'm sorry.
No, we're good, man. This is awesome. I love learning. Neurophysiologist and neuroscientist who's dedicated to improving outcomes for children and families affected by complex brain network disorders. Based in Omaha, Nebraska, and licensed in Iowa and Texas, Dr. Thodeson combines clinical expertise with cutting-edge research to advance the understanding and treatment of conditions such as epilepsy, traumatic brain injury, neurodevelopmental disorders, and functional neurological disorders. Driven by a mission to bridge the gap between research and real-world patient care, Dr. Thodeson recently founded a privately owned neuroscience research company and a boutique neurology practice. These ventures allow him to focus more deeply on individualized care, translational neuroscience, and collaborative projects that push the boundaries of modern brain health. Through partnerships with hospitals, universities, and nonprofit organizations across the U.S., Dr. Thodeson provides medical advocacy and consultation to ensure families have access to accurate information, innovative therapies, and compassionate support. His work reflects a lifelong commitment to advancing neuroscience while empowering patients and caregivers with knowledge, hope, and direction. All of this is so desperately needed by the folks that we are trying to help in this world. Dr. Thodeson, welcome to the show, sir.
Thanks, Bruce. Thank you for that great introduction. I appreciate you. I'm a big fan, long-time listener, first-time caller.
Dude, man, all in, man. You win the prize. Hey, Danny, what are we giving away today? All good, man. So what put you on this journey, Drew? How'd you get there? How'd you get there?
Yeah, well, thanks for having me on, first of all, Bruce. I'm a pediatric neurologist at heart. After I got my medical degree, I went to Children's Hospital in Pittsburgh. And it was right in 2009 that I started up there, and the Penguins had just won the Cup. And they had Yevgeny Malkin and Sidney Crosby, and they were going to take the world by storm. And then the next year, Sidney Crosby had just a terrible concussive injury. And it sparked fear in that town. And we were seeing kids come in left and right after concussions, and in the emergency department, I did a quality improvement study just to see where we were. And what we found was, in that flood of concussive injury, all the docs, no matter how experienced or little experience they had, they were confident in their diagnosis and treatment. Okay, whether they knew the science or not. We did a teaching intervention, and their confidence didn't change, but their knowledge did, now, of the paradigm at that time, which turns out to be, evolving. But it taught me real early on in this field that confidence is not competence, and everyone was really super confident in treating concussions, whether they knew what they were doing or not. And that experience really changed how I thought about these invisible brain injuries, and how easily we can assume and understand that we know what we're doing just because they look simple.
Right. And so where was their confidence misleading them? I mean, we know that. Does the confidence come from, like, we have a CDC checklist that says, all right, here's your return to play, and if these get banged up, I mean, yeah, you can call it a concussion. And did that confidence, sounds like they might not have been digging deeper into some of these concussive issues, maybe the subconcussive exposure, how long the kid's been playing, whatever.
Absolutely. I mean, you don't have time in the emergency department. You're trying to put out fires and stuff, especially when you're learning. And our targeted audience were first and second year medical doctors, right? They are green, man. Um, but and right at that time, right in 2009, 2010, CDC had put out heads up, this concussion protocol, which has gone through different iterations, changes since there, and has evolved as the science has evolved. Um, but people were confident in sort of seeing it, diagnosing it, and not even knowing that, which is pretty basic. So it just struck me that just because you do 4 years of medicine and medical school, and you did undergrad, that doesn't mean you know what's happening in these complex brain injuries.
Wow. And so where did that take you from there? Was that just the start of your own personal journey into understanding this better?
Yeah, well, man, I got to tell you, residency training is a grind, and I did 5 years in Pittsburgh, and kind of did went away from concussion a little bit because it got owned. Okay, that's the other thing about disorders or diseases. They start to get owned by certain subsets of doctors, and in Pittsburgh it was owned by the neuropsychologists and the physical medicine and rehabilitation doctors. So I kind of gravitated away from it, and got into epilepsy, did some training in Dallas, and while I was there I actually saw patients who had seizures but there was no electrical signature, and that's functional neurological disorder. And one of the predispositions of functional neurological disorder is repetitive concussions or subconcussive injuries, right? And I started trying to study that a little bit more, and some of the concussion specialists in Omaha, this is a decade later, right, started referring children with prolonged post-concussive symptoms, headaches, dizziness, fatigue. Some of them had seizures, brain fog, and many of them had MTBI, concussion, but some of them had overlap that were it was confusing to me, and it looked a lot like FND, and the overlap is really striking, Bruce. And some experts, I don't know, but some people, there's an argument, it's a minority opinion, that post-concussive syndrome may actually be a form of FND. My idea is these are both brain network disorders that overlap. And what I do know is that sometimes what starts as concussion, it leaves a scar you can't see. And it's not in the tissue, but it's in the brain circuitry somehow. And that circuitry changes perception and prediction in the brain. And that idea that brain injury and brain function blur led me to ask just basic questions. Well, how do we measure these invisible changes?
So all right, and before we even get into that, explain to our audience how contact sports, now post-concussive trauma or post-concussive syndrome, which, number one is not done by 90% of the parents whose kids have concussions, right? 2 weeks, you're cleared, return to play, right? Nobody mentions, our son had 3. Nobody ever mentioned, hey, can we come back in 30 days and can we continue asking questions to determine if this brain injury has healed up? Never happened. And I'm sure that contributed heavily to the continued degradation of our son's brain because he just kept playing, right? And there was no respite, right, for the brain. So explain to the parents out there how whether it's just one concussion, or a series of concussions. What is post concussive syndrome, and why is it so important to pay attention to that?
Wow, that's a great that's a great question, Bruce. Um, Let me back up a little bit. Some of the stuff we know about concussive injury and what happens to the brain is when we concuss mice and rats.
Hmm.
And 100% of the rats or mice are better. Their brains are sort of back to normal at 4 weeks. But for people after one, 60% don't have symptoms, right? You can't cut up someone's brain at a week, right? That's not, that's, you can do different things to rats. And whether or not that's ethical, I'm not going to say, but it's been done. Um, but at 1 week, symptoms are gone at 60%. At 2 weeks, it's about 80%. And at 3 weeks, it's 90%. And then there's a really long tail. Okay. But that's if you're just asking, are you dizzy? Do you have headaches? But if you dig deeper, it's that number who have that long tail, that post-concussive syndrome, where you have symptoms beyond 4 to 6 weeks, is probably closer to a quarter of people or 30% of people.
Really?
And we don't dig. We don't dig deep enough, you know. I was on a plane with a woman last week. I was doing a lot of traveling, and she was a she's the nicest lady, and we were talking about just life, and then she said, well, at 30 minutes in or whatever, she said, well, what do you do? I said, well, I'm a neurologist and I'm doing this stuff. And she's like, oh my gosh, I was in a T-bone car accident 3 years ago, and she was banged up, man. TBI, all sorts of stuff, other injuries too, and she still has symptoms to this day that fluctuate. She'll have a bad day, and all the stuff will come back. She's got the ringing in the ears, the brain fog, some of this other stuff. I didn't go real deep, but man, she never had anybody give her a great history or do the due diligence to see what kind of symptoms she's having. And we're just scratching the surface of that, because we all have bad days. But when you have recurrent concussions, multiple brain knocks, right, you're more likely to have the symptoms for longer. It takes longer to recover. Um, Not only if you have concussion multiple times, if you have other brain disorders, autism, ADHD, epilepsy, migraine, you're more likely to have prolonged concussive symptoms. And these things are common, man. Like this, so it's not surprising to me that up to 30% of the population that has concussion, even one, will have prolonged symptoms. And that's why Medicaid and Medicare, CMS changed MTBI to recognize it as a chronic condition, because it is chronic in a lot of people. And most people, you don't get one concussion. You have all these subconcussive forces that happen, especially people who are athletes. And who are athletes? No, 90% of them are kids. Pee wee football. Um, they're having subconcussive injury from the moment they put the helmet on, man. So, yeah, we're putting a lot of our children who will end up being our adults, right, at pretty big risk for this chronic brain condition, which can manifest in pain, mental health problems, you name it. They're all brain circuit derived problems.
And where have your studies or research indicated that? I mean, there's talk now about not just the mental health disorders that I think we know now are the like red flag, the canary in the coal mine when you have
Mm.
overexposure. Um, but what about taking it there's some correlation now between other neurodegenerative disorders, Parkinson's, ALS. things of that nature. It sounds like epilepsy is part of that. I have several friends right now that I played rugby with back in the day that are suffering from, just like that, Parkinson's mostly, right? Tremors and stuff going on. I meet football players at our church. They got two of them there, one a D1 guy, one NFL guy, both of them, and they come up to us and say, hey, do you think my shakes could be attributed to, my playing? And how long did you play? Well, I played in the NFL or I played D1. That's a lot of playing. Back when, football had little tiny leather helmets and stuff, right? Or whatever, right? So what are you seeing now? Are you seeing correlation to even, more severe conditions other than, mental illness is severe, don't get me wrong, but other more, I don't know, like more pronounced disorders and the space that you operate in?
Yeah, it's a good question, Bruce. The historical context of this actually came out of Pittsburgh, right around the time that I was there. At a neighboring hospital out of Pittsburgh, they they started looking at ex-NFL players' brains, right? And they found, I can't remember the exact numbers. Let's say there were 50 of them, right? And they found that 49 out of 50 had CTE, had degenerative changes on autopsy. Okay. And that one guy who didn't, he was a kicker. He was the only kicker in the group. Okay. But I bet there's a percentage of kickers that have it too, because kickers used to be linebackers. Okay. It used to be the quarterbacks, used to be wide receivers. Okay. So their risk might be lower, but it ain't zero. Okay. So this concept from there has come, oh, concussions can cause neurodegeneration, right? And we kind of already knew that because we have a figure in public life in America that represented that. Muhammad Ali, Cassius Clay. He took a lot of punches to the face. He did the rope-a-dope, but he left his arms down. He took some blows, man, and he developed Parkinson's, and that is known in neurology even before CTE. So this concept that repetitive brain trauma causes a cascade that then can lead to neurodegenerative disorders is known. The question is, how does that happen? And some people are really in this space, are really interested in the neuroinflammatory markers, and I believe that plays a role. But I also believe that the brain is an unbelievable network, and it shares different pathways. Let me give you an example. There are 86 billion neurons in our brains, and those all connect to each other, making over 100 trillion connections. Okay. We got a universe in our brain, man. To understand how that universe creates this final point is something we're just scratching the surface of. And those correlations between mental health and neurodegeneration and all this stuff are really complex. My mother has atypical Parkinson's disease. This a neurodegenerative disorder, right? There's no treatment. There's no cure. There's a tremendous amount of other brain network dysfunction that goes along with it, including depression, anxiety, impulse control, headaches, pain. All these things are interrelated, Bruce. And in some people, like Muhammad Ali, it came out with the shakes and the inability to move. His mood seemed okay. He was always in the and in some people it comes out as severe depression, homicidal, suicidal. I mean, people are dying because of this stuff, and we can't get enough data soon enough so that we can really make real world changes.
It is kind of a shame that, Muhammad Ali, who was such a force of nature, people can see him physically suffering. And yet, and I'm sure that it turned off quite a few parents from a boxing career for their kids. But yet we still box, right? It's still a way out for some people, right? I guess, and that's their own. But you mentioned earlier that this correlation between repetitive head impacts and functional network disorders, or neurodegenerative disorders and or mental illness has been known. Man, you mentioned Mike Webster was one of the Steelers that was identified by
Mm,
Dr. Omalu back in the day. We've
yeah.
had the wife of another person that was on our show, and so it's known. Yet here we sit in 2025, still talking about something that's been known since 2009 when you were in residency there. So, quick question is, why, in your opinion, are parents still unaware of this potentiality, of this connection between RHI and severe neurological disorders to include mental illness? Why do we still, including myself, okay, subject our kids? Why is the knowledge not there for us as parents? Yet, as you say, it's known, right? I mean, you're a neurologist. I mean, your kids playing contact sports?
Well, he's 7.
Yeah.
He, yeah, I'm grateful he's not into football. But hey, I was in team sports my whole life. Now I played basketball. I was a runner. So I didn't play collision sports, but I've had concussions, Bruce. I then went to school. I didn't have like a big manual labor job. But there are people machinists and stuff, who are around rattling machines all the time. You think that causes some problems? Maybe. Um, there's a lot of environmental factors that we don't know how to quantify or qualify in terms of their risk. And I think the reason that parents don't know is because they are confident that they know what it is.
Ah,
And they know, well, that's just a ding. That's just oh, you got shook up. Walk it off, rub some dirt on it. And you got a lot of that still going on in places where football is life. Okay. And it is a way out, and you see these guys um, making millions of dollars, and then not only that, but now you got guys in college making millions of dollars,
true.
playing football. So it is a way. The economy has incentivized this to an extent that it hasn't been incentivized before. So I think we're seeing things get worse. Not only that, but our world has changed from 1970, right? And this goes into one of the research initiatives that I have about LED lights. LED lights flicker, and you can't see it. Okay, it turns on and off hundreds to thousands of times a second. And this invisible flicker of LED lights, your brain can feel, even though your eyes can't see it. And we found that people with concussion, recurrent traumatic brain injury, migraine, other brain network disorders, epilepsy, autism, are very sensitive to this flicker. And we're trying to get funding to vet a study to use functional imaging to see how just some of these basic things, these like light bulbs, how light bulbs affect our brain, and how that might change how an injured brain um, evolves over time. And so even when these lights look steady, the injured brain can feel them flicker, and the flicker can make the brain work overtime Could that make inflammation worse? I don't know. But by decoding how the brain reacts maybe to this invisible flickering light, we might find new tools, not just for diagnosing injury, but maybe even promoting recovery.
And how would that, do you think, one of the parts that, we always kind of hammer home is that a child's brain is developing. Okay.
Mm.
And, our big problem with the CTE industry, it is an industry, is that, you've been focused on these adults and professional players all these years and some high schoolers. Why has nobody ever published a study on, hey, can we take a break with these kids? It's got to be doing more harm. What is your research in terms of like epilepsy and other neurodegenerative disorders? Does that indicate as well that, a child's developing brain being exposed to subconcussive trauma is somehow, more, risky or, more impactful than a mature brain, say after the age of 25?
Yeah, well, it's got to be. Okay. One thing I will say, Bruce, it's a double-edged sword, right? Or there's two sides of this, in my opinion, and there's probably multiple that I haven't even thought about yet. But number one, a developing brain is incredibly resilient. Okay. If a child has a stroke when they're less than a couple days old, that same stroke in a 30-year-old man will totally handicap the 30-year-old
Hmm.
man. But the child who's 1 day old will develop around the stroke, and they have a much more greater capacity for neuroplasticity, right? This idea that you can reroute some of these trillions of connections to take over. They might have a little weakness or something like that, but if it happened in a 30-year-old man, they'd be fully paralyzed on one side of the body or another, right? And so, and that child will grow up with different kinds of risks: epilepsy, autism, intellectual problems, cognitive problems, susceptibility to concussions, maybe autism, these types of things. However, those are not written in stone.
Hmm.
And so, with the correct supports, which starts with a loving and patient family, a good medical team, physical therapy, occupational therapy, speech therapy, and good nutrition, good sleep habits, all these things, right? Supports, that child has a way better chance than if I were to have a stroke right now. Okay. So that's neuroplasticity. That's the miracle of the brain. Okay. But you're right, it's developing. And what if you take a normal brain and then you start junking with it ever since they're 12 and they can put on a helmet? Okay. What does that do to normal development? And we really don't know. And this arbitrary cutoff of, oh, once you're 18, you're a man or you're a woman. Well, female brains develop, connect, still continue to make these connections all the way up until 29, 30, and male brains a little bit later, 30, 31, 32. And so our brain is developing into our late 20s at least. And these are the people who, are in war zones, who are in athletics that are, getting repetitive brain trauma. Um, and we just don't have the tools right now to identify it. We're starting to get there. People are saying that DTI and some of these blood biomarkers are really good at diagnosing concussion. I'm coming from a neurophysiology standpoint, so I'm using EEG, brainwave studies, QEEG, event-related potentials, but all these give you snapshots, right? And you have to piece them all together because it's like doing 10,000 piece puzzle in pitch black dark, and all you got is a little pen light. Good luck, man. It's hard. It's really complex, but people are out there, and if enough people show up with their pen lights, maybe we can put some pieces together.
No, that makes perfect sense. And I want to go back to neuroplasticity because there are people out there that says, contact sports can't hurt a child's brain because it can repair itself, which I call out, which is absolute crap. I mean, to your point, for a stroke, for an incident, yes, the brain, in our opinion, can heal itself, but the repetitive and relentless exposure to RHI produces damage that no neuroplasticity cannot keep up with. And then you start throwing in long-term chronic neuroinflammation and all the other issues that are taking place, man. And the brain gets overwhelmed. Is that your opinion as well, or do you have something different on it?
Absolutely, Bruce. No, you're right on track with that. I mean, it doesn't make any sense to say, oh, neuroplasticity is going to save us. In fact, from the epilepsy standpoint, which is another brain network disorder, okay, just like concussion, okay, if you, in animal models, if you tickle their brain with electricity over and over and over and over again, actually the neuroplasticity gets messed up. Okay. And those same mice start growing neurons and connections that they would not grow if they didn't have electrical tickles. Okay. And so, yeah, of course, if you replace electrical tickles with physical concussive force, you think that could mess up the machinery that is supposed to be taking care um, uh, of neuroplasticity? You bet, man. You bet.
Are you coming across anything in your research that indicates that there could be a tie between, epilepsy, autism, the disorders that you specialize in? Any relation to subconcussive trauma and the long term exposure these kids are taking?
Yeah, it's weak. But I think I think we don't know.
Uh,
Um, and so what they for TBI in general, the rates of epilepsy, if you have a severe TBI, which means you're in a car accident and you had a skull fracture and you had to have neurosurgery, your risk of epilepsy lifelong becomes about 50%.
wow.
Okay. And if you had a moderate TBI, which means and clearly someone with severe TBI has brain imaging differences, okay, on conventional MRI scan. If you have a moderate TBI, where you have injury to the brain on MRI, but you didn't need neurosurgery, your rates of epilepsy are about 25-30%. And mild TBI is no different than the general population. There ain't no way. There ain't no way that that's the case, because mild TBI, which I don't really like that term, I prefer concussion, but that form of traumatic brain injury is so variable and has so much to do with how many you've had, what are your other co-occurring brain symptoms, what are your other co-occurring body symptoms, um, and it's so much more common, right? So you got 80% of 80% of TBIs are mild TBI, or concussive injuries. How can you differentiate that from someone who's had repetitive injury that has never had a concussion, quote unquote? And it's just it gets really hard because 60% of epilepsy is what we call idiopathic, which means we can't figure it out. We don't know why you have it.
Hmm.
So is some of that related to repetitive brain trauma? I mean, I can't tell you that the research has fleshed that out, but it's worth looking at. And as brain science evolves, we gotta ask some of those questions. Some of those questions, the answer might be no, but if you don't ask those questions, you don't. I call it the brain cannot understand what the eye is not willing to see.
Well, I mean, you got the problem of, these are great questions to ask. It's just that our researchers want to keep asking the same questions over and over in order to get funding. And then we don't do anything with the knowledge, which kind of stinks. But so let's move on a little bit to like treatments. Okay. I mean,
Yeah.
treating the brain right now, that we really, as you said, we don't understand how to treat it. We mostly medicate it now. We give them all, we give SSRIs, SNIs, we hand out candy like it's Halloween, opiates like it's Halloween. I just learned this yesterday. The VA, it was the largest opiate prescriber in the world. And because of all the attention it's gotten, it's dropped opiate prescriptions down. It's down to the 67% of what they used to prescribe. And they're still
Mhm.
the largest opiate prescriber in the world. you know, so we don't treat the brain, we medicate it. So when we're talking about subconcussive trauma, repetitive exposure, and I don't know, I'm trying to see how this moves, but you deal with TBIs. A lot of these modalities that can help, whether it's, brain supplementation, nutrition programs, electronic therapies like photobiomodulation, neurofeedback, HBOT, yada, yada, the psychedelics, which are out there just doing a lot of good for veterans. And then, outpatient procedures. What are you seeing now? Are you seeing any change in how you're dealing with epilepsy and autism from a non-traditional, hey, let's just dope them up perspective? And what are the more promising procedures that you're seeing out there that could, help, people that have brain damage?
Yeah, really good question. So this is the crux of brain health. Okay. Is it mental health or is it neurological health?
Mm,
And I think that difference, that separation has harmed people. Okay. It is all brain health, brother.
thank you.
Okay. And I know you know that because I've listened to your show a few times and I know you preach that. And I do too. Um, there are um, certain neurological conditions that absolutely medications are needed. Okay.
Amen. Yep.
Um, man, SSRIs are not the evil one. Okay. They have saved people's lives. Okay. However, when you use them indiscriminately to, oh, you have this checklist of symptoms, therefore you're depressed. This is what we use for depression. That is not the right way to do it. It has to be individualized. Okay. And even if, let's take it to epilepsy for a second, even if I prescribe you an anti-seizure medicine, the first one works 50-50. Okay. So I got to be ready for it not to work. Okay. And then I got to pivot. And if I don't tell you that you got to sleep 8 hours, you got to eat whole foods, cut out all the processed stuff, you got to meditate, you got to work on your serenity, your well-being, you
Spiritual.
gotta yeah, neuro spirituality, man. You can develop neuro spirituality that can heal, that heals much more effectively than a medication. Now, you need the medicine too, but if you don't do these other three things, plus get some exercise, plus take care of other health conditions you may or may not have, hey, the medicine's only going to get you so far.
Right.
So, one of the reasons people go to a doctor is they want a cure, okay? And a cure is very rarely seen in a pill. We can cure pneumonia, okay? We can cure some blood infections. We can cure a UTI. However, or urinary tract infection. However, when you're talking about curing a subset of 86 billion neurons that make 100 trillion connections, dude, it's not going to come in this little blue pill. Come on, man. You know what I
Right.
mean? Come on.
Yeah.
There's no way. And what the problem with that is, the way that medicine is structured is we don't have time. We don't have time to talk about this. You know, you got to get in and out. I got to see my next patient in 30 minutes. I don't have time to tell you what kind of foods to eat, what kind of whatever to eat, and so you have to educate people in other ways. But the best way to educate someone is to sit down and spend time. Because a man told me once, Bruce, much wiser than me. He said, Drew, you know how to spell love? And I said, yeah, John, I do. And he said, Time. And it's so capitalistic, this medicine
Oh, God.
business that we do, that there's so doctors, it's not that they don't want to, it's that they can't, or they
Oh,
think they can.
I know people that are leaving the medical health profession because of the way they have to treat people. And, you know, I know folks right now that can't get paid unless they prescribe, you know, and they're in the mental health industry. Like they have to prescribe a pill. They don't get paid. And it's like, I just say, come on, man. I mean, and to your
Come
point,
on.
we're trying to fix a very complex ailment that's contained within a highly complex organ that we will never be able to match the capacity of the brain. I don't care how many quantum computers you bring on your AI, 90% of it, which can't even do what it's supposed to do. And you say, we're going to replicate the brain. No, you can't replicate consciousness. You cannot conceptualization, emotion, all the amazing things that we can do. But when they're impacted, the last thing we need is a lifelong, prophylaxis of pills and chasing
Well,
symptoms.
there's got to be on ramps. There's tons of on ramps. There's no off ramps, bro.
No.
Why didn't you build the off ramps? Okay, so people are starting to look at that, especially with like methamphetamines for
Benzos.
ADHD and stuff, benzos. People are starting to look at off ramps, but it's like people had to die to look for off ramps. Are you kidding me?
No, look at our veteran population. How many veterans are no longer here? All of them, which were given bags of pills. And you know, and I don't care what people say about the VA. They're not an evil organization, but they
No.
go by the book. And the book is, hey, you got a problem? Here's a pill for that problem. Oh, you got another problem? Here's a pill for that. We got to change the book. We got to rewrite the book because the book has harmed. I mean, it's not just veterans. This is all throughout. I mean, we prescribe 95% of the pills in the world for mental health are taken right here in this country. And we don't have brain health treatment centers. We don't optimize brain health. We'll teach you how to, optimize your carbohydrate intake and your HVR and all this other crazy stuff about your health. But we never focus on what's good up here. And I think, getting the word out that, hey, contact sports, especially with developing brains, is not a good idea. I think we gotta get that. We got to get that moving. So where else?
What works?
Yeah.
What works?
Well, okay.
Right?
What works?
Let's talk about what works. What works is eating whole foods. Okay. And not doing a bunch of high fructose corn syrup. Okay. Get away from the ultra processed stuff. Eat 3 squares. Have some snacks. Get your omega-3 fatty acids in there. Stop cutting out all fat. That fat is good for the brain, man. Eat your proteins. Don't buy into that 1970s food pyramid that put corn on the bottom so the corn subsidiaries. I'm dead serious, man.
Yeah. I used to eat baby food because of that thing, man. I was a weightlifter, man. All them carbs. I need them carbs,
Yeah.
No fat. Can't have fat. Fat's not good.
I just read about like these protein powders. They're putting lead in them, mercury. Eat whole foods, man. Eat whole foods. Get your brain right. Don't skimp on the fat. Don't go all low fat. If you want to go low anything, go a little low carb. Get your proteins, get your fats. And Get your 8 hours of sleep. Do your best to get your 8 hours of sleep, ideally not medicated. But that means you got to do routine. That means you got to pause. You got to meditate. You got to pray. You got to ask for help. Okay. You got to stop stiff upper lipping it, and you got to ask for help from the universe, and the universe will help you. Now, there are some really interesting neurotherapeutics that I'm interested in. Neurofeedback certainly can retrain your brain. Guided meditation certainly can retrain your brain. I'm very interested in two technologies. The first one is called transcranial magnetic stimulation, using magnets to retrain, to sort of work on monitoring or changing connections. And the other one that I'm really interested in is HBOT. But they got to be protocoled, man. All this, there's too much. Oh, yeah, if I do it, you'll get better. No, 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 no.
Yeah,
You
there's
got
a
to
lot of
give your
ego. A
protocol
lot of
out. You
ego.
got to subject it. You got to subject it to scientific thought. You can't be the only one who can do it.
Right.
That ain't right.
No, I mean, if you look
And I've
at
heard you call
TMS,
for that, protocols and
yeah, and there's basic. I mean, we can all agree. Like in HBOT, I know one guy that does it this way, and then I went to a clinic and they said, no, you got to do it our way. It's not effective. I'm like, well, all I know is that every veteran that's been in a chamber has said this has changed my life. So it doesn't sound like there's that much variance in effectiveness if we're trying to keep people on Earth.
yeah.
And then TMS, you got ETMS, you got MERT, you got all
Oh,
these
yeah.
different combinations of TMS, QEEG, which you mentioned earlier, and we got but all of it's out of pocket, and that's the other big pain of this is that, none of them we're trying to push to get them covered under, MTBI is still TBI. You got concussion billing codes, brain treatment for some reason we could bill the damage and we could bill the drugs, but we can't build a treatment plan that is more important than anything, if you ask me. I mean,
I think it's coming, Bruce. I think it's coming. I think but people need it now, and I feel your
amen.
frustration with the cost. Um, uh, the healthcare industry is, there's so much money in it that it's gotten criminal almost.
Yeah.
It's like there's 25% of the gross domestic product of the most um, wealthy nation in the world ever, with the most billionaires ever, and that's healthcare. And
Yeah.
we can't get you HBOT.
Right? We can't. And you know what the killer is? My wife found this out. There is an HBOT machine in every hospital because of wound care. Yet
Yeah.
you can't bill it for brain health. Yet every hospital has TBI patients coming right in that emergency room. There's a lot of indication that HBOT therapy right after a major TBI is so beneficial for the brain, but you can't bill it. And so we have an entire medical healthcare system that's not properly incentivized to produce dramatic changes in patient healing, but it's all about making money. I mean, if we if we just took the modalities that we just talked about into our jails and made them available to the American population, we would not only reduce the amount of pharmaceuticals that is out there, we would reduce every ill out there at a fraction of the cost of what it would take. So for a veteran that's on just the average of 10 prescription drugs a year, that's close to $30,000 a year that we're spending on that veteran just to have pills. And then we start talking about they're not employable or they're suffering still from they're medicated. They don't even want to be here anymore. And we're not giving them job training, and this is just veterans. Everybody needs this, right? We're just talking about the guys, the girls that get a lot of attention because they served our country, right? But then you start talking, years of that. 30 years later, most veterans retire in their 30s, bam, their 60s. That's $1 million worth of drugs that if we could apply $40,000 to $50,000 to every veteran for whatever they want, HBOT, neurofeedback, psychedelic treatments if they want them, brain optimization. You talk about whole foods, about eating the fats, making the brain healthy, exercising, which all veterans know how to do, not a run, most of them. And then we got, some outpatient. We could spend most 40 to 50 grand. These guys are mortgaging their house, their cars. I see parents with kids that they give us calls that have been around football for years. Now they're in jail. They're doing drugs,
Mm,
doing all this stuff. And now Timmy's been playing since he was 6. Well, let's get him these treatments, because do we want to
mm.
spend $40,000 and have somebody paying taxes for 30 years and helping this country? Or do you want somebody that's on a lifetime of drugs? That's what pharma wants. That's what healthcare wants. And that is just wrong. So I absolutely agree with you 100%.
Yeah, Bruce, I love how you talk. I don't know what the answer is. I don't know if we can know yet.
Mm,
But what I do know is what you're talking about, that idea of this pill's going to fix your brain.
mm,
That's just not true.
no.
Okay. And I know that. Okay. And so we got to keep asking the question. We can't just keep making new SSRIs or whatever it is. We got
Yeah.
to ask the question. And and that's the
Sorry.
psychedelic thing, right? Where it's like, hey, can we use ketamine? Can we use um, mushrooms, psilocybin, um, to do a drastic change? And I don't know. It's not good for people who have addiction, but they're even using it in addiction
Oh, yeah.
and people are having changes, and but it's not a one size fit all.
No.
That's the issue. We got to stop thinking about it as mental health. We got to think about it as brain health, and it's got to be individualized. There can be a base of what everyone needs: good nutrition, good sleep, good fats. Stay away from the processed food, neurospirituality, meditate, get a program, and then maybe there's going to be a subset of people where it's HBOT, where it's psychedelics, where it's maybe even medicines, because they got some serious suicidality and stuff.
Oh,
But
yeah.
there's got to be off
There's a
ramps.
reason.
There's got to
There's
be
a
off
reason
ramps.
for drugs, man. Don't get me wrong.
Yeah.
But yeah, we got to start asking the tough questions. All right, as we close out, Drew, tell us, how do people find you? Where what do you have going on? What does the immediate future look like for Drew? What are you focused on? And and how people can contact you with questions or to seek out your services.
Well, thanks, Bruce. So I just started these businesses. I've been in healthcare for 15, 20 years, but I just started my two businesses, MBBN. It stands for Mind, Body, Brain, Neurology, but it's just MBBN. That's my neurological practice, and then MBBN Research is my research practice. I'm working on websites and stuff. The easiest way to get in touch with me is either through LinkedIn, Drew Thodeson, or mbbnresearch.org. Just threw out my first article from the desk of Dr. Drew, and it's all about MTBI and how we've changed the definitions, a little bit of what we talked about today. And I'll be throwing my research up there as it comes out. And yeah, that's the best way to get a hold of me.
Cool beans, man. Well, Drew, thank you so much for coming on the show. You definitely have it, from the world of epilepsy and autism, coming in and letting us know, it's still brain disorders. And I love your comment. It's not mental health, it's brain health. And we do know that by optimizing the brain, by optimizing my brain, I have, solved I'm still got a long way to go. I'm a flawed human being, right? But I'm still a servant of God, and I'm going to keep working on it. But you're absolutely right, and thank you for a wonderful perspective on the issue of brain injury and how we can make things better. And we hope to see you on the show again.
You bet, Bruce. Yeah, one day at a time, brother.
One
We'll
day at
keep
a
on
time.
working on it together, man.
All right. And folks, thank you for another episode of Broken Brains. We really appreciate your time here. Remember, go to our website, download our book. If this show comes out early, December 13th, Army-Navy game, Panasonic Ripid Energy drinks. We have Horse Soldier Bourbon, Fuel, an actual rock concert. 100% of the money's raised goes to veterans, mental health and suicide prevention services. Don't forget about the app. It's on the website, Google and Apple. Like us, subscribe us, push us out to your friends. We appreciate y'all's support because, again, we're the only voice in this country for repetitive brain trauma, and you are now part of our network. We hope to see you soon. You got children, take care of those melons, man. They only got one of them. Take care. May God bless you all and have a great day.